Okay, so, good evening, everyone. Welcome to November's, as I think about what month it is, November's Quality of Life Committee meeting. We're gonna start out, the first item on our agenda, which should be quick, and is also the rest of the committee agrees. There's a new piece of legislation, which I will let Kevin take away.
Don't forget to introduce yourself. Absolutely. Hi, everyone. My name is Kevin Williams. It's nice to be here. Thank you so much to Madam Chair Meltzer and also the Chair of the Quality Life Committee, Ms. Pat Moore, for having me. My name is Kevin Williams. I work for Congressman Dan Goldman. It's really nice to be here. Can you hear it through the owls?
People are saying they can't hear.
Oh, okay. I'll come a little bit closer and speak a little bit louder, okay? Can everyone hear me now?
Yes.
Or if
We're not talking about the room, we're talking about the owl. On the owls.
You
Yeah.
can come around over here.
Yeah, that's fine.
Can you promote any board members up in the room?
All right. Can everyone online hear me now? Between everything.
I can hear you, but you're low. Sorry. I can use the benefit. Thank you.
You might want to sit down, but you're not showing up now.
Oh. Sit down.
Find you.
Nice to be here with everyone. My name is Tevin Williams. I'll say that all again. I'm Tevin Williams. I'm the Director of Community and External Affairs for Congressman Dan Goldman. I'm here tonight to speak about one of the Congressman's priority bills, which is called the Michelle Go Act. As many of you know, we and a lot of your advocacy here on this committee has produced something that obviously happened out of a tragedy a couple of years ago with Michelle Go. Unfortunately, she was tragically pushed to her death in Times Square a couple. Simon, who shoved her, he was a long-term care mental health treatment center, and he was unable to receive the treatment that he needed and deserved, and told and went around saying, if someone does not help me, I'm going to commit suicide, unfortunately. And so unfortunately, this fell on Michelle Go. But out of that, came a really great bill that we have at the congressional level. It is a version of this bill is at the city council level that Council Member Eric Botcher is also carrying at the local level, and there's a state bill by Senator Brad Hoylman-Siegel. But this bill has been introduced with bipartisan support with Congresswoman Malliotakis, surprisingly, and then also Representative Bilirakis from Florida. And then we also introduced this with a member of Congress in California named Representative Cardenas. So I'll talk a little bit about what this bill does, give you the highlights, and then I'll answer some questions from anyone on the board. This bill is vitally important because it increases the number of federal Medicaid eligible inpatient psychiatric beds for individuals. So what that means is this will give treatment to people who are mentally ill, who need services, and also substance abuse disorders as well. This also allows us to cover institutions up to 36 long-term beds. This is an arbitrary number. It has been made up figuratively that you can only have 36 long-term beds. This is under federal law. This lifts that cap, essentially saying that multiple people can now get these services. This is also going to increase the access to mental health care. This will increase the access to services, allowing the facilities with more than 16 beds for low-income patients. So if you can't right now afford any type of like inpatient care, Medicaid, as we all know at the federal level, reimburses that. It's going to help with that tremendously and encourage smaller facilities to expand. For example, in Park Slope, in part of our district, we represent Central Brooklyn. New York Presbyterian, which is a huge hospital system, just opened another psychiatric center there to provide a lot of the mental health facilities there. We're going to continue, the Congressman's going to continue to do community-based mental health care, as many of y'all have spoken on this committee. And as many of you know, if you could go to slide 8 for me, Zach, there's a visual up now. Loading that. As many of you know, just the back one, there we go. The cost of this inaction is just too great. As many of you know, this man has been charged. Oh, perfect. So this man has been, I'll back up one slide right here if you want to turn your attention to the screen. This has had a huge, across the nation, a broad array of support from the National Association of Counties, the American Society of Addiction Medicine, multiple organizations in the mental health field have endorsed this bill because it will help tremendously across America, as we're seeing many people in the mental health crisis fall through the cracks. And just a couple of quick things. As we know, this cost of inaction is just too much. Many of you know this was in the Times. There was a man that was killed, that was charged with killing 3 people, stabbing people across New York City, across Manhattan. Another person that was unprovoked in what he did, but also had mental health issues. And had we had this bill and lifted the cap, this would definitely help. We have to break this cycle. Many people are going from hospital to jail, outpatient, hospital, jail, outpatient. It's happening all across our district. We represent Washington Square Park. I will tell you, it is a huge humanitarian crisis there for everyone. Sorry, I can't turn this way, but there's a huge issue there as well. We also have a few shelters in the Brooklyn piece of our district where people are just not getting the care they need. And as we'll hear later, y'all will speak about that for the city. But this is a really big solution that has bipartisan support, especially coming into this next administration that we're having, that the Republicans do believe in this as well. We're gearing to introduce this again in Congress. This is my last point. We're gearing to reintroduce this bill in Congress next session. It has a broad array of support that I mentioned. It's going to break the cycle of patients bouncing from hospital, jail, and outpatient and psychiatric, and it's going to help tremendously in New York State. So that's all I have to say. I'm happy to answer some questions if people have them from the board, and I will turn it back to the Madam Chair and the Chair of this committee.
I have bullet points here that I can read to the committee. I wanted to know whether we all agree to do a reso based on these bullet points. So if you want me to read them, some of you have it. Some, oh, do you want to say this?
Please read from public record.
Oh, okay. So this federal legislation honors Michelle Elisa Go's memory by increasing access to inpatient mental health care to prevent future tragedies. On January 15, 2022, Michelle Go tragically lost her life after being pushed in front of an oncoming R train at the Times Square 42nd Street station. After the attack, a 61-year-old man experiencing homelessness and suffering from schizophrenia admitted to shoving Go in front of the train. According to news reports, after showing signs of schizophrenia in his 30s, this man spent time bouncing between hospitals, jails, and outpatient psychiatric programs without ever receiving the long-term care he needed. Those suffering from mental illness are far more likely to be victims of violence than perpetrators, and this tragedy provided a stark reminder of the glaring gaps in our mental health infrastructure that leaves far too many people to fall through the cracks. Under current federal law, Medicaid is prohibited from covering long-term stays for patients between the ages of 21 and 64 who are receiving mental health or substance abuse treatment in a mental health facility with more than 16 beds, known as an institution for mental diseases, or any facility that's known as an institution for mental disease. And I asked why it was the specific age, and then we discussed it, and it was because anyone under 21 is under a child care, and anyone over 64 is on Social Security.
Right.
And medical care. Yeah. Representatives Dan Goldman, Nicole Meliatakis, Tony Cardenas, is it?
That's right.
And Gus, what is his last name?
Billy Rockets.
Bill Rockus introduced HR 8575, the Michelle Go Act, to address the serious need for increased inpatient psychiatric bed capacity by more than doubling what is currently eligible for federal Medicaid payment under the IMD exclusion. The bill would allow more flexibility under the IMD exclusion for states and counties to expand long-term psychiatric care by raising the cap of Medicaid eligible inpatient psychiatric beds a care facility can have from 16 to 36. So that means it can raise it from 16 beds to 36.
Correct.
Okay.
Yeah.
The bill mandates that mental health facilities receiving federal Medicaid funding adhere to nationally recognized evidence-based standards for mental health and substance use disorder programs, ensuring high-quality care. The last point, the bill has received endorsements from organizations including the Treatment Advocacy Center, National Alliance on Mental Illness, National Association of State Mental Health Program Directors, National Associations of Counties, National Association for Behavioral Health Care, Stand with Asian Americans, Asian Americans Rise, National Association of County Behavioral Health and Developmental Disability Directors, New York Junior League, and the Schizophrenia Policy Action Network. So we can change these bullet points. Some of you have it, some of you don't. Those who have it, maybe pass it down to let other people see it. So if you agree, we could take these bullet points and turn it into a reso. Jared, you want to look?
No, I heard it.
You heard? Okay. So,
Can I just ask one question? Because I agree with everything. I know you said 36 is an arbitrary number. Do you think they did that because if they put a higher number, they might get some resistance? Or because there could be, if there's, let's say 45 people, so 7 people, a certain amount of people just get thrown back to the street, or you think that it was kind of like a calculated thing?
It's a very old law. It's very arbitrary. Like, this was not something that was.
No,
done.
but I'm saying for this, though, like, I would be, like, personally, just myself, be in favor of not having a cap or make it 50, a larger cap, so that, but unless you think, or the congressman thinks that could maybe jeopardize other people voting against it, because they don't want to turn it into a factory.
well, I guess the question is, was there a reason they ended up at 36?
Right.
Yeah, I think this was, for us, this made the most sense, like when it comes to Medicaid reimbursement for now, when we reintroduced this bill. I don't know if anyone really followed this, but this was Congresswoman Maloney's bill before we took it. So we just retweaked it when we got it. And this was the closest number we got for reimbursement for Medicaid. And that's
Okay.
what we chose as of right now.
Okay,
We can reintroduce it and make it higher. We think that makes
or
sense.
maybe put something in the bill where it's like a flexible, like, as as needed, but with that as a starting point, I don't know.
Yeah, that's good. No,
Mhm.
I'll gladly take that back.
Is this a mandate or it permits?
What do you mean?
Does it mandate the facility to provide the
Yeah.
beds, or does it just?
Yeah,
that they
yeah,
have
yeah.
the discretion?
Anyone that's getting federal funding that is taking that, it
Yeah,
will say
it
that this,
mandates, okay.
yeah, that it lifts that cap of that. Yeah, go ahead.
So I wanted to know if we could add a stat that keeps it hyper-local, that blends really well. The New York City produced a report, a 2023 survey, which showed that 8% of all adult New Yorkers had recently experienced some serious psychological distress.
Mhm.
There's a whole study in there, so I think that that's really relevant to put in here, because
Cool.
as we fight about homeless and mental health and the staging and the steps for everything, trying to include the local statistics from the report that was issued in March this year, I think would be really important.
Sure thing.
Question though, 8% of all New Yorkers,
Adult New Yorkers,
adult.
2023
That would be
survey.
650,000 people.
It says among
36.
6 million adults in New York City, it says nearly 1 in 4 experience a mental health disorder in a given year, similar to the national average. But it would be really good because it says more than 2/3 of adults with a diagnosis received treatment in the past year, but 34% report unmet mental health needs, not receiving as much treatment as they would have wished, wanted, or have access to or opportunity, which can be due to cost or stigma. So, and then it goes into different stats about which age groups within that and which national.
The question though is, so this is Medicaid, and a lot of people have private insurance,
Correct,
and private insurance also is lacking.
correct.
But I wonder how we tie that in with,
I think to start here, for those who are the most vulnerable, who don't have the resources for private
That's
health
the point of it
insurance,
too.
is where I'm kind of trying to tag back to this study to make sure that we do go down this road and we talk about how locally important this is as a driver for helping in this, the 360 holistic look.
I mean, Pat, as by supporting this, it doesn't preclude anybody with private insurance doing whatever they want.
yeah,
That's it.
This is more of a broader comment, I guess, about this and the similar types of issues. It is so painfully difficult to navigate any of these systems. So it's great that they're going to be funding it, but how on earth are people supposed to actually navigate it?
So, a couple of things. If you look at the hospitals that are in our district, they will tell you that like the people that need these services like can not only afford them, but they don't have the capacity for it. So that's why this like addresses a few things. It lifts the cap on that. We have, for example, my mom lives in our district, which is in like the southern part of Brooklyn. Their whole healthcare system is based off of Medicaid, like period. But like nationally, there are other organizations and like hospitals that.
So that's sort of what I'm getting. I'm recently helping a friend who was at my mom who is trying to navigate a similar similar issue in Medicaid. And, you know, I'm a lawyer and I'm good at paperwork, and it was impossibly difficult. How is anybody supposed to actually use these services?
Well, the good thing is, and y'all are probably gonna talk about this a little bit later, but like, there are so many outreach services that like need some help and like do this work every day that like, this was something they supported too, because there's just not enough people that need that help.
Totally different, but we should probably at some point talk about, because there are a lot of issues with people navigating, like
Yeah,
Medicare for
Yeah.
people over
It's a big
65
one in
and
our
older.
district,
There are a
too.
lot of issues with navigating, you know, structural, institutional organizations.
yeah.
So,
But I think also, I do want to make sure everyone understands, like, this is a step in the right direction.
Yeah.
This is not a silver bullet for
and
anything.
it's not all
But it's,
encompassing.
right, it's definitely, there are a lot of other healthcare things that we fight for, but this one is particularly important for New York City.
Question, Kevin.
Yeah.
We were talking, when we were talking about the bill before the meeting, at, Zach and I said that we probably need to also bring something about just fully funding Medicaid, period, because, right, that affects so many different things.
Of course.
You know, this and you put money in this and then something else, you know.
Yeah.
Learning disabled children miss out because
Yeah.
it doesn't go to schools or anything. So we need to fully fund Medicaid.
Sure.
Does it make sense to do that, in December though? I guess, think that, not really.
We can talk about if there's a bill that we can like bring for the next meeting for that.
Okay,
But I haven't heard, the priority right now, at least on our side, has been like social security and making sure that Medicare is good. Medicaid, we tried and made strides to that, but
Mhm.
I can do some research on that and see if there is a bill to fully fund Medicaid.
So this might not be able to be answered this evening,
Sure.
but given that there is a consensus that these systems are very difficult to navigate, is that something that can be built into this? That there is some level of insurance of like a patient navigator or some staffing or some liaison that facilitates this to actually be able
Well,
to
remember,
happen?
this is supposed to help like the most vulnerable people that like are on the street that need these services, but there's like a cap on the number of beds and there's not enough reimbursement from the facilities and hospitals that are providing that. If there's like a follow-up bill that y'all want to talk about, I think that we need to do
Because yeah,
something
this
for that.
doesn't really address how they get to.
Yeah.
So-
Right. Well, again, this came out of like the tragic incident that happened,
Right.
but if there's follow-up bills behind it, we're happy to introduce.
But I
them.
would think that somebody's taken from the hospital, instead of being released to the street, one of the medical people there or one of the social workers could recommend them to a program. Once
They
they're-
also could sign themselves in.
Right.
Could be a
Exactly.
number.
But I mean, to me, there's no downside to supporting this. And
No, I'm just saying, it doesn't address.
That's a good point.
Yeah. So can we?
But that's the next
Yeah, can we
iteration.
vote?
Yeah, that's a follow.
Any more questions?
Public ask a question?
Shelley Freeman, I'm registered. I'm curious, of all of the facilities in New York City, if all of them that could take these patients could lift the cap to 36, how many more people would that be?
I don't know the answer to that right now.
And my follow-up would be, how many?
But remember, this is like the federal piece of that.
Well, I
They
know,
lifted
for New
the,
York City.
yeah, no.
For our little neighborhood.
No, I understand that.
It's 20 more beds per hospital.
How about
Yeah,
in your district? Do you know the answer just for your district? How many more
I don't.
people?
I don't.
Do we have
Oh,
a form?
Justin is on the line. Yeah, Justin.
No, I think that you just asked the question because that was my concern. This is a great start. Thank you. And thank you for the bipartisan collaboration. Congressman Goldman, excuse me. This is so important to get this started, and it is, I think, hopefully going to help people get the help that they need, right? But my biggest question was that 36 beds per hospital is not enough, but as you say, baby steps, right?
Yeah.
Jill, did you have anything you wanted to say?
No, I think it's a great thing. Thank you, Kevin, for bringing it.
Yeah.
No problem.
Since it's not my committee, I can call them.
Second.
Okay, we seconded, right?
Yep.
We're voting. All those in favor? Yeah.
We don't count, but yeah.
Aye.
Yeah.
Hold on.
Abstentions from users.
So that's okay. So you have all in favor? Okay. No extensions, no recusals. Okay, so with that, so
Thank
write
you.
the reso and have it for the full board next week.
Thank you so much.
I
Thank you all.
forwarded
And if
the,
anyone has questions, please reach out to me.
Tammy, that's just forwarded.
I forwarded to the chairs and Zach where I quoted from the
The
website.
report.
Yeah.
So that could be tagged and added because it shows the extraordinary need for it.
Perfect. Thank you so much.
And I can send that to you.
Yes, please do.
Thank you, Kevin.
Yeah, of course, no problem.
Good to see you.
I don't know.
He can vote yes. He can vote yes. He was here. Yeah. Ideally, maybe he actually read the materials before.
Okay, we're moving on. Kevin, thank you. Of course. I'm glad you got your back.
Thank you.
So the majority of the room I know is here so that we can continue our discussion about 320, the shelter. So as you know, Chris, you're here. And you have a presentation. Would you like to start by?
Sure. Why don't we introduce ourselves?
Yep.
Chris Gonzalez, the Chief Strategy Officer at the Department of Social Services. We have a crew here with DeMar Otis, Deputy Commissioner, Friends of Government from the legislative affairs of the Department of Social Services.
Can you guys speak up closer to the owls, please? Because you're mumbling from us online. Thank you, sorry.
I gotcha. Do me a favor. Would you mind moving down
Of
to
course.
where
Of course.
Jared is?
Of course not, I wouldn't.
And then
And
you
then,
guys.
and then if you don't mind, who's ever presenting, sitting at the table so the public can hear clearly because it's more. And you should move on this one, which could be done to do that, right? From the microphone.
All right, well, we're introducing ourselves. So if you didn't hear me the first time, Chris Gonzalez, DSS. All right, Jamar Hooks, Deputy Commissioner for Intergovernmental and Legislative Affairs at DSS.
Tracy Bakan, Manhattan Borough Director, DSS.
And then provider.
Yeah, hi, I'm Erin Madden. I'm the Vice President of Programs at Breaking Ground.
Patrick Vaughn, Vice President, Communications at Breaking Ground.
Hi, good evening, Heather Fry, Breaking Ground Deputy Vice President of Programs. I oversee our transitional housing portfolio.
Good evening, Julie Harrison, Assistant Commissioner for DHS on Program Capacity.
Thank you.
Great, so we did bring a brief presentation, so I'll start off with the first slide. So, one of the main topics of discussion when we last met was the population of the safe haven. And there was a request made for to be transitioned or to have the site turn into a families with shelter site, families with children site. Unfortunately, because of the design elements of the site, we are unable to transition it to a families with children site. The question came up also about having the site be only women. We looked at the numbers and the demographics, and really there just isn't based off of the population, the low barrier shelter population, there just really isn't a need to have a full women's only, safe haven. So what we did was we looked at, our population and tried to figure out if there were opportunities to, make adjustments to, allay some concerns about, volatility or, concerns about our population.
Were there
So,
any considerations of only like teens, adolescents, children?
so our sites are not for children. That would be, those are ACS specific sites. So our sites are for adults.
Let's hold to the end, because I have my own list of fairly irate questions and comments to add, and I'm sure everybody in this room does. And they're here, hopefully they're listening, and hopefully we can have a robust discussion. Max is here, I want to say, before you continue, Max is here from Councilmember Marte's office. And in full disclosure for everybody in the room, Tevin, Max, all of our electeds were on a call earlier today with Community Board One and reviewed the letter and had a nice robust discussion, and I will report out after Chris is done with his presentation. Go ahead.
Sure. So, after some discussion internally and looking at, our population, we came up with, these three, focus, groups of, our clients that, we would propose, narrowing down, the population for this site. So the first one is older adults, experiencing street homelessness, so that's 55 and up. The second is medically vulnerable street homeless clients suffering from at least 2 comorbidities. So that would be diabetes or some sort of actual physical health ailment. The idea here is these folks are sometimes have mobility issues, and so they're going to be less mobile than maybe the general population. And then the third is the anyone requesting a reasonable accommodation. And again, reasonable accommodations are requested because this site is an elevator building. Reasonable accommodation this building could support folks that are applying for reasonable accommodation.
What's a reasonable?
Yeah, I was
what's
gonna say,
that?
Please define what reasonable accommodation is, and I will just note that all buildings required to be handicapped accessible.
Right.
Well, so Julie, do you want to talk about reasonable accommodation?
A reasonable accommodation for the Department of Homeland Services is an individual or someone who has an obvious or inobvious need for a service, right? Obvious would be someone that's legally blind, that needs, assistance in order, an elevator building such as 320 to come into. Another obvious one, someone in a wheelchair that's a double amputee, that's obvious. Inobvious ones may be someone that, has a hearing impediment, okay, which is not obvious to the naked eye. Others are very obvious to the naked eye that that person needs accommodation. Others are not so obvious. So when we say 2 comorbidities, it could be physical, it could be mental, and it could be substance abuse. And it's a combination there of all of those things for a person. We have a unit within the Department of Homeland Services called the DAFN unit, the Disability Affairs Functional Needs area, that works with us under, as Tammy is saying, most of, we have an obligation under Butler lawsuit to make accommodations for anybody entering one of our sites, to our best ability to accommodate where we can. So that's what the reasonable accommodation process is.
Yeah, but all of your facilities have to be ADA.
No, we don't all have to be ADA. Many of them grandfather because they, wait,
The new ones.
new one.
That you
Right,
opened,
right.
including 105 Washington,
Yes,
correct?
those have to be, because we do have to meet the standard, but I'm saying we have other sites.
We're not talking about other
Okay,
sites.
but this particular site, yes, has to be ADA compliant and meet the standard for a reasonable accommodation.
So did 105 Washington,
Yes,
right?
ma'am.
Okay.
So,
No, keep going, Chris.
Sure. So we're gonna move on to one of the questions was just general understanding of the school safety plan.
Yeah, and so since our last meeting, we did meet with the school leadership as well as one of the co-presidents from the PTA. We walked the sort of area with the school leadership. We discussed strategies of how we can make plans for our operational staff during the day, during school dismissal or drop-off times, as well as other events. We're also going to be, the school is going to be hosting a Q&A where we will be presenting. Hopefully that will be happening in December. And so we'll continue to have conversations with the school leadership to get their feedback on our operational plans as we continue to sort of move forward with opening.
So you are continuing to move forward. You have signed your contracts?
No, we do not have an executed contract.
And while we're looking at this, just explain the color coding here.
The blue is the play street, the yellow is the school itself, and the green is the safe haven.
And where's the hotel?
Same thing.
Where's it say?
It's,
Oh, I see.
It's-
I'm sorry, I missed it down there. I'm looking at trees, okay.
So as we were doing, if you can go to the slide, yeah.
attached.
So as we, met with the school leadership, we did specifically talk about and walk this area. And Chris, I'm not sure if you want to mention it, we did release a letter about the new populations of where we also discuss our commitments around doing privacy screening, specifically for any, we'll do it for all windows, but also any windows that are facing the school. And also privacy screening on that front floor. And if permissible, we are also discussing putting a temporary barrier, if you want to go back, sorry, a temporary barrier that we could have on the sidewalk during the school dismissal and lineup times, so that we can also direct our residents to be using the other end of the block when they're exiting the facility.
I'm sorry, direct your residents to.
Direct our residents to just use the other side of the block if they're exiting.
Oh, you may walk in the other direction?
Yeah.
Right. Okay.
Into the bus stop. Shouldn't that happen anytime school is open?
I mean, anytime school is open,
Correct, yes.
it's.
Because kids go in and out for field trips. It's not arrival and dismissal. It's arrival, dismissal, play street, field trips, after school.
So the Fulton Street subway stop is the closest avenue is to walk and cross the street, right at that corner. If we're also have folks with mobility disabilities, like mobile impairments, it's gonna be difficult to ask them to walk additional blocks just to go to the subway. That said, we are still committed to operationally monitoring that sidewalk as much as we possibly can throughout the day. But it is a public
But you
sidewalk.
see why this is a bad location.
It's a public sidewalk.
It is a public sidewalk, but you can see why it's a bad location. I know you're not gonna say that, but we're gonna say that, because if they have to go in that direction because of limitations, then they're gonna have to interact with the children.
I mean, we were there during the day. There was no children entering or exiting when we were there. We were there for over an hour. So, and yes, the play street was there.
It's a 10-hour day that the staff and the building is open. You're there for 1 hour. That
We're,
does not represent the entirety of
we're
the
not
day.
saying we're only going to be monitoring the sidewalk for 1 hour. We're gonna be monitoring the sidewalk the entire time the school is in session.
So you're providing security for the school then potentially.
I said we were monitoring the sidewalk
What
throughout the.
exactly does it mean? Can you detail what a monitor program would be?
So we have security cameras that would obviously be on the
That's not live monitoring.
You asked for a whole plan. I'm trying to give
Okay.
you a whole comprehensive plan.
New information.
So let's continue.
So there is security cameras, obviously looking on the front that we have at our entrance that will monitor the sidewalk and provide information to our security team inside. Our security team will consist of 2 guards who will be monitoring not only the entrance, but also the cameras as well as the space. We expect them, at least 1 guard, to be moving throughout the entrance through the entirety of their shift. In addition, we also have our residential aid staff who move throughout the building as well as the outdoor space throughout the entirety of their shift. During the school hours is when we have the majority of our staff on site. In addition to our 24-hour security, 24-hour housekeeping, 24-hour residential supervision, during school hours, we have an additional 18 to 20 staff of social workers, leadership positions, psychiatry, and other specialists who will be on site during school hours. And they are all part of our operational plan to maintain a safe community for our residents inside and outside.
Do you have anything else to add on the security plan?
Nope.
No, just Hang on a second. Is there anything else you have to add about what you've shown for your slides? Because I have questions immediately on the slides.
Do you want to just go to the one where you talk about our, again, our services and operational plans? So, yeah.
And we're actually not there on services yet. No offense intended to you. I'm sure you are very excited to share with that. But I think the community and our elected officials are all standing together with CB1. This is not an appropriate location for a safe haven. And even with your letter, Chris, you did not come back. There is an extraordinary need for supportive services for beds, supportive beds. That's a shelter model that DHS has, which are the most functional of the homeless people that we have in the city, people who potentially go to jobs every day. There's no reason that you haven't been able to present to us something other than a safe haven model. The only conversation you've had with us that we have all said, from the people who live next door, to the people whose families have worked at Breaking Ground, to the elected officials, to everybody else who has come to us at the community board, and what we have said back since the first announcement, this is not an appropriate location for a safe haven. And you told us this is a real estate deal, and that the real estate deal is with Breaking Ground and Slate. And we are still saying, since DHS is representing, this is not an appropriate location for a safe haven. If you have to come to us to have a plan to clean sidewalks from needles attached to where the entrances are, that's a problem. That's like a greater, it's a solution, but that should take a look at a greater problem that this isn't the right location. You cannot guarantee us the canopy will be approved by LPC, correct? LPC will also have to approve your temporary barriers. And there's been absolutely no conversation about the outdoor deck.
I mean, the outdoor deck will, that will not be open to clients just like all the time. That will be, if there is any activity out there.
Open at all with smoking.
The upper level deck, we're not planning to use that as any type of outdoor, like if that recreational space is used, it would be used for programming, like gardening groups or things like that. It would not be a standing smoking area for our clients, no. Now, the backyard deck, we are still a backyard patio, which the school overlooks. We are assessing all of the options right now in terms of canopy and other, things that we could do to address smoking if we were to allow it. There has been no permanent decision made about how that outdoor space will be used. We're assessing all options to ensure that we are meeting our promises to the community.
And so the outdoor deck that you would use for programming, how is that going to be shielded from the students at the school?
So that one, right now, that one would be fine to have temporary, I mean, they did have it during the hotel. They had some like temporary trellising and things like that. So again, we would put in temporary, sort of transparency, privacy, all that other stuff. And we would only do it if and when we can meet those privacy concerns.
And those have to be approved by LPC, so you cannot guarantee the community that any of that will happen.
But if it's not approved, then we would not use it.
At all.
Correct, yeah.
And the courtyard?
Again, if we cannot find a solution, then of course we will not use it. That is our commitment. That is the commitment we are making as the provider. There has been questions around maintaining privacy. We have made the commitment that we will do everything to ensure privacy. And if the privacy means we can't use the space, then that's what it means.
But Erin, and this is a conversation we've had with other facilities in the community. The reality is people smoke. And if you cannot use anything internal to that facility, then people are going to go outside. They're going to go outside and smoke anyway. But you're limiting the amount, you're increasing the amount of people then who are going to have to go outside to smoke. And where are they going to go?
Stand out in front of the building underneath
We
the
ask,
school window.
we ask our clients to not stand in front of the building, and that is part of what we do at all of our sites, is we ask people to go for a walk. There are many public spaces that are within walking distance of the space, including, over near Fulton and things like that, and that's what we would do.
Nothing like a playground. There are playgrounds and parks.
Right.
There are playgrounds and parks that are supposed to be no smoking.
Yeah, and if you're gonna ask them to go, we would like to know specifically where you would ask them to go. Because right across the street is a playground.
We're not asking them to go smoke in a playground.
No, I know you're not,
They-
but I'm saying there is. So, all right, please. We're handling it. Let me get your turn.
I'll be quiet. I have a lot
Yeah,
more.
you have questions, come forward.
For Chris, we asked very specifically for other uses. The letter that you sent defines more safe haven, does not give any other type of usage. There was reporting about the extraordinary need for supportive beds, which would not be family necessarily, but could be single men or single women who are at the end of their homeless journey, have gotten some success, gone through the programs. Please explain why this housing, which is, as you have said, set up specifically for singles, could not be utilized and offered for that, in consideration that we have two safe haven shelters, one in CB1 and the other one right next door on East Broadway. CB1's is open and filling, and then the one on East Broadway will open. Why can't this be a different location so that people who actually are finding success in safe haven shelters have the place to go once they've, quote, graduated from some of those programs?
So we can certainly take that back. That is, remember, all the supportive housing portfolio is run by a different agency. So, any sort of development on that side, we'd have to discuss with them.
Which agency is it?
HP.
Sorry. HPD.
Great. We would like you to take that back to HPD. That is a
Is
strong.
there a reason why it couldn't be switched from your agency to HPD?
At this point, the programming has been, established for this site.
No, but was
So,
Breaking
No,
Ground
I mean-
runs supportive services as well.
I understand that. This would be a larger discussion that's in, interagency, and so we have to, raise that. As, see if that's an option.
So let's have Erin answer the question, because Breaking Ground does offer that type of business model as well.
We operate supportive housing.
And so why was supportive housing on the part of Breaking Ground not considered for this location?
It's not our building. We don't own it. And
But you're
so
partnering, and that is
Yes.
what your partner,
our partner brought us the site to operate as a safe haven. They did not bring the site to us to operate as a supportive housing. And they are the ones who are responsible for all the modifications to the building. They are the owner. They would have to be the ones to get any loans or anything from HPD to do it. So it's their decision of how they want to use their property, and they chose to use the property for safe haven. And they just decide.
hold on.
That's what I was.
Can you speak to the financial differences between Safe Haven Mall and supportive housing?
No, I'm sorry. Like housing development as like in terms of how that all works, that's not my specialty.
I wanna, hold on.
I don't know what.
Go ahead of you.
There are lots of people who had their
Sorry.
board members, and the gentleman who's on the left here, comes from a family from Breaking Ground leadership. So I'd like to recognize him and have him ask a question. Go ahead,
So I just wanted to.
please announce your name.
My name's Anthony Hannigan. So I do know about the financials a little bit. So safe havens are, basically how they're paid is built out on similar to like what the hotel rate would be. So that is why Slate is bringing the safe haven model to you, is because they make the most money. So for a building that they bought for $24 million, their the 5-year contract is $50 million, with an extension to go up to about $100 million.
So just to.
Stop.
So
Raise your hand.
I know that not all of that money goes to Slate. A large, and we did review the contract, and the actual amount that went to Slate was not publicly made available in the contract, because they said that you're still working out those numbers. But Slate is getting a very large portion of that money.
Slate does receive rent, and rent is honestly approved and negotiated by OMB. And I'm sure no one is surprised here that OMB drives a very hard bargain. They are the ones who set all the rate schedules for any shelter.
Right.
I will say, when it comes to supportive housing, that is a complicated mix of loans and various other things, because they would have to drastically do major renovations in this building, because again, the building is not immediately set up to meet HPD new standards in terms of SROs and single room, like basically supportive housing. So I'm sure there was a financial calculation on their part, but there's also, this is what they were able to do with the site, with the funding that they had available to them.
Erin, what's the difference between what would they have to do to make it acceptable to be supportive housing? Does it have to have a kitchen?
Yes.
Yeah.
You have to have kitchens in every unit?
Yes.
Okay.
There also has to be minimum square footage for every unit. There has to be storage. Like there's a lot that goes into it.
And there-
HPD, all these requirements I think are available on the
If there
HPD
are also
website.
there are also waived exceptions that were done due to the emergency pandemic, which we know because it happened under de Blasio in 21 and I think even later for certain locations, not in Manhattan, but in other boroughs where they utilized hotels for children's shelters that were, with babies aged 0 to 9 months or whatever. Have been exceptions made due to the homeless crisis. So while we're quoting back to rules, note that there have also been cases where the rules were bent.
You know what, Francis, did you have a question?
Just about the barriers, can you describe what that's gonna be like, and is it coming with a person?
So our staffing is our staffing, and that's what
That's the barrier?
no,
It's
our
not a
staffing, but I already discussed our staffing pattern. So that is our staffing pattern where we will have 24-hour security, 24-hour residential aid staff, 24-hour housekeeping, as well as a whole host of clinical services that are on there during school time. As we operate Safe Havens, we are holistic. Everyone is a part of our safety planning. In terms of the temporary barriers, they do have to be DOB sort of, not DOB approved, but sort of in line with DOB specs. So we are assessing what those options are now. Anything on the sidewalk, because it's public sidewalk, would have to be a temporary sort of thing. So what we're looking at is what those options are, a planter on wheels and something like that we
see
could
us go
fit in
through
and out.
everything and anything, because it's a historic district.
Can I ask a question?
No, Jared's not.
So, two things. One, the letter from your commissioner referenced that the site is not suitable for a shelter for some reason. It doesn't say what that is. What is it about this building that is not modifiable like any other building? That's the first sort of question. And then the second thing was offering up the 55 plus as a compromise or inclusive comfort. The community doesn't really, I don't see how it does anything. The guy who went on the rampage yesterday with over 55, that Michelle Go, sure we spoke about a while ago, was over 55. I'm not sure if it was meant to offer comfort or a compromise or what, but it doesn't address the core question here, which is how do you think this is an appropriate location? This type of site, as important as it is, that nobody's debating that part of it. It isn't, it's not a bad, it's a profoundly bad location.
I mean, so I think, listen, we understand that there are challenges with any site that we are going to use for our temporary housing facilities. I think one of the reasons that we felt comfortable moving ahead was because we knew we had a provider that had a lot of history in working with these type of facilities as well as these type of populations. So, the idea, the concept was to continue moving forward because we have an experienced provider. And we will do what we can to ensure as much safety as possible, to ensure as much communication as possible. We have, as Erin said, we met with the school and we're trying to, work on as much of a plan as possible to make sure we're in constant communication with. This is, we want to make sure that we're doing what we can to make folks feel comfortable.
But it's never gonna be like, in a lot, I'm sure you encounter almost in every location, as you said, that people don't necessarily function in their backyard. I'm sure there's a lot of resistance that you encounter. But this is immediately next to the school. It's not down the block, it's not around the corner. They have entrances right next to each other.
And they don't run any other facility that's next to a school.
Right, but it's very difficult. On one hand, appreciating the work that you do, which is critical and necessary, and very much appreciated in a lot of ways. And not looking at this very cynically as ultimately a real estate deal and in the most valuable type of operation in there. What is it about this building though that makes it so modifiable, make it a family shelter? I think the article in the Times this week said 1 in 8 students in the public schools are homeless. It seems like such a happy medium. Why is it impossible? What's so special about this building that makes that impossible, other than the fact that it probably comes down to money?
Well, I think we highlighted this last time, that families with children's sites have specific design
Right,
elements.
what is it? The letter said that. But what is the design element that the letter reference that makes this site incompatible? Why is this different, going different than every other building?
It's size of the rooms, it's.
But you're doing demo.
We're not changing the footprint of any of the rooms.
I'm sorry.
We're talking
We're
about.
not changing the footprint of any of the rooms.
What is he saying?
Yeah, of course. It all comes down to money. You could take, you're talking about drywall and you're talking about, this is not load-bearing brick walls that have been there for 100
It's
years.
interior.
I mean, it's
Modifiable.
everything's modifiable.
And especially when you look at NYCHA Housing, when they ran out of gas, they had nothing but electric, right? So they were told to use, thinking specifically, they were told hot plates or convection ovens, which don't have that same issues that gas does. And they lived that way for months and months and months. So the rooms are already plumbed. So we know that there's a sink there, a toilet and a shower. So having something that's akin to a mini kitchen and an efficiency when we've got the city of Yes telling us that we could live with smaller apartments and we can do SROs for general housing to tell us that it's pursuant to what Jared's saying, it's a little untenable at the moment to understand that. Because there seems to be two separate messages coming from the city. If you're willing to pay a lot of money as an individual, you can rent a smaller apartment because we want to get more people in apartments. But we can't have that same conversation with square footage about getting our most vulnerable off the streets as a family.
Doesn't think it's an option.
Like, there's two.
What, you're next?
Yeah.
Okay.
One, two rooms, and it's not like.
May I?
Yeah.
Okay, we spoke the last time. I just have, 3 questions, one of which is just a sort of a comment, but when the property owner, the developer, comes to you with a site to partner with you, what, if anything, do you do to evaluate the appropriateness of the site? Or do you say, okay, you got the site, we got the, program, happy medium, happy marriage, let's put it in a proposal to the city? Or do you ever turn away someone who says, I have a site, I'd like to operate a shelter, and no, this is not, you ever say this is not an appropriate site? Or do you go with every site that somebody comes to you with and put the proposal before the city? And I'm talking to Breaking Ground.
So all of the sites do have to be approved by DHS. They all do go
But
through.
does Breaking Ground ever say, oh, well, no, this site, not for the school right now? I mean, have you ever done that?
Yes, we have turned down various sites.
So what about this site? Did you evaluate that you said, oh, this is great, this is an appropriate site because it's Breaking Ground shelter?
So the biggest thing about this site is one, that it is an elevator building. We can provide a lot of privacy for individuals. That's one of the core components of a safe haven, is that it's not a dormitory style setting, which traditional shelters are.
So it's okay for SROs style housing?
Well, did the location being right next to the school, did that enter into the considerations at all?
Yes, it was something that we definitely took into consideration, and it was a big concern.
Okay.
And we only moved forward because we felt confident of our program and our ability to work with the community, that it could be a viable space.
But I just have to interrupt for 1 second. You said the ability to work with the community. Which
Yes.
community? This community or the
So
community?
as we've already, with all of our safe havens, what we do here is the commitment that we make to every place where we operate a safe haven.
But this
is-
community doesn't want it.
Is that I mean, unfortunately, there are other places that don't want us either, but our clients are already there. And so what you have is our commitment to constantly have an open door of communication, to frequently meet you, to frequently hear your feedback, and constantly do better every day until, as we move forward with this, because our clients are already here. They are already in and a part of your community. They are just sleeping outside. And we are trying to find a space for them inside. Because as you saw with all of those stories around people who experience serious mental illness, was the cycle of the constant moving in between institutions. And this is what is different and why safe havens work, because we are not the place where
Let's
people.
not question the safe haven model. We like to say, what we are gonna question is that it's right next to the most vulnerable. You have vulnerable people who need your help, but you also have the most vulnerable, which are children. Children.
Pat,
So it
can I-
doesn't make any sense.
Can I just ask the other, quickly?
Hurry up.
Number two, are you aware that basically, Slate, what they do is that they take the contract and they use it as security to borrow money to develop more shelters? I mean, they're not just getting the money from the rent or the rent, they take that contract, go to a bank, and they borrow money. This is, I read this up.
Refinancing.
Yeah,
refinancing.
yeah.
10 million.
Okay, yeah, let's not have this.
So, I mean, that's just a comment, but that's really the financial model in which they operate. It's like an expansion, it's an expansive, operation where they get a shelter, they can take the revenue from the shelter, borrow more money, get more shelters, and make,
Leverage.
more profit. Yeah, leverage, that's the word. All right, but that's just a comment. The last question I have is, there was a hearing in front of in the controller's office on the contract, last month. I don't remember the exact date. I was at the hearing remotely. Has the controller, issued approval of this contract as of yet, anywhere from the controller?
No, it has not gone to the control.
But the controller did have a hearing.
No, the mayor's office of contracts had a hearing. That's part of the procurement process.
I could have sworn it was the controller's office. Maybe I was wrong.
So the controller the contract doesn't go to the controller until it is signed.
Oh.
And then needs to get read.
So the hearing was the mayor's office, of contract. And and what you're saying is that has not yet been approved from them as yet. Or has, it? You tell me.
I think it's a 30-day approval after the hearing, so, what was that, the night, so I can double check it.
It was October 24th.
All right,
So I want to address, Erin, what you said about services and providers and people. Because we have the experience of the 105 Washington. And this goes directly back to Chris. And the two of you need to be able to, it needed to be contracted differently. It needed to be staffed differently. It needs to be done differently. Because the real estate deal that you're talking about and the staffing you're talking about are all about the needs you have within the four walls of the shelter. What we have seen from the failure of 105 Washington, which the community board embraced as a location for a safe haven for numerous reasons. It was a still changing neighborhood with land that was available. 5 World Trade hasn't been built. There was a vacant lot. There were other places that were developing that were not built out yet when they first came to us in 2018, and the building had been empty for a decade. So we supported the opening of a safe haven and tried to work in good faith with you guys for everything there. What we have seen, no matter how many staff you have in the building, is immaterial to what happens on the sidewalk. Once you have people in the building, your staff, your psychologists, your drug counselors, your everything are in the building working with clients. They don't walk out the building and work with the clients in the street. When you send them outside for smoking, if they're not standing in front of your building, you have absolutely no idea other than the cameras where they are. There have been neighbors who have seen people who have declined service sleeping on a mattress within 400 feet of this shelter. But the staff.
75 feet.
Part of my lobby.
okay, so
The staff cannot leave 105 Washington because they are not the outreach team to deal with the person who's on the street. Because that is not the safe haven model. You don't have an outreach team inside because you are compensated for the people who are in the building. And once people leave your building, pursuant to how we now understand the system, if they decide they decline services, they now go back in the system and Breaking Ground will say, John Smith declined services. So when John Smith is found another time by an outreach person, but the operator of said shelter does not do anything to contact the outreach team, contact a bid, take another step outside what their responsibility is for the person because they've left the building. It's kind of like me saying, you know what, Erin, this is a really interesting topic. I'd like to set up, love to talk to you over a cup of coffee. You said, yeah, great, let's have a cup of coffee. But if you never make that connection again, that coffee never happens. So for that person, until that person is touched again by some outreach team that is not you, they're out in the wind and they're back in the community. Maybe they kind of liked your shelter, maybe they didn't. And they're now hanging out in front of the construction site because no one's going to bother them there overnight.
So that's not how we operate safe havens. Our staff do, and this happens at all our safe havens now, our staff do go out into the community on regular intervals to walk around to see where our clients are in the community, to make sure they're following what the behavior we expect them to follow, because we don't want them to be at risk of getting tickets, of getting arrested, or doing, or anything else, or being ill in the community. So our staff do not leave the building. That is common practice. We already walk around the building. And honestly, we have had clients who are sleeping across the street and our program directors go outside and outreach them and get them to come inside. And we've had them waiting in our lobby, trying to get the outreach team there so we can make the referral and get them in. We are not so like, oh, you're outside our door, you're not our problem. If you are someone who's experiencing street homelessness and we're seeing you, you are who we are here to serve.
I kind of heard the same thing.
That's my commitment. That's the commitment Breaking Ground makes for all of our sites. And you can hold me accountable to our commitment.
I am struggling with a crisis of faith as a board chair who believes in DHS and the work that you do, but believe that there is a large gap. So unless in your contract you have an outreach team that is separate or additional staffing that is really responsible for the exterior 2-3 blocks.
Wide
around, it actually, I mean, if your building opens and you are full at capacity, your team is busy inside dealing with the people who are your constituents. You are not watching, live body watching.
But some of those folks may be our constituents, right? That's what the concern is.
But
So
your constituent goes outside to smoke, right? You don't have barriers up because LPC doesn't allow it, and you can't have smoking inside because you made the agreement with the school. They're standing outside because, as you say, they're not necessarily mobile enough to go very far. So they're gonna stay on the same block. So maybe they're sitting in the bus stop, maybe they're sitting at the school's open street.
no, I mean, then we're gonna work with them to find some other solution. That's the whole thing, is that we don't give up
With
in
105 people that are in your space.
And also, I mean, I'm not sure why everyone thinks all of our clients are chain smoking every minute of every day, but they're not. And so like, we will find solutions. That's the whole thing. It's an ongoing conversation. And maybe we can't find the right canopy today, but maybe the right canopy will exist in a year from now. It's
But that
always
doesn't-
about assessing things.
That doesn't work for the 4-year-olds and the 3-year-olds. They're in pre-K.
But what I'm saying is that you have our commitment to never stop working on it.
And what we want is the DHS commitment to not be a safe haven, because if you're doing on-site psychiatric care, you have clinical and you have harm reduction specialists, extensive programming is needed. But next to a 3-year-old, if it was in the same house or building, the parents would be taken to court for child protective services for exposing your kids. I mean, it's just kind of the way that goes. It's not a great fit next to a place that you have small children. It's a great fit down the block, around a different way. It's a great fit when you're not in between a pre-K to 5th. It's sort of stunning. Like, I hear what you're saying, but the reality of what we understand of how the shelter operates on the other side of the neighborhood,
which
is different.
And that is not us. And that's all I can say. is that
It's a DHS facility.
Right, but
And it's a DHS facility, and we have been through a CAB and we've been through other meetings, and this is the way it happens, that the provider inside is responsible for the clients inside. Not necessarily, maybe it's a new client who hasn't gone to outreach, who's just hanging out because they're friends on the inside there. It's just not a great location. And I can't imagine with the closing of some of the other shelters, that there's no other location that isn't attached to a school,
Another building in this community.
an office building that we can turn. I mean, Andrew Kimball and the department and DCP were talking about taking vacant older office buildings and turning them into housing and shelter. So
I
where,
would love to talk
I
to
guess
them.
that goes to Chris, where's the city on that? Why are we here attached to a school?
So, I mean, so there's two separate things there. So one is obviously there is an urgent need based off of the numbers that we see for street homeless activity in the area. Separately, yes, obviously we're in a housing crisis and there are a lot of ideas being floated as to how we can, rework our zoning code to be able to turn commercial buildings into housing. 100%, that is a huge priority. That is also, the development pipeline is a long pipeline. Those buildings won't be ripe for any sort of occupancy for years. This area needs additional,
Opening on East Broadway. You have another facility, which is less than a quarter of a mile away opening. You opened one on 105. We
It's not
have,
built to capacity.
that's not filled yet. We have capacity being built immediately. I don't know how delayed you are on East Broadway, but Max, do you know? But I mean, it's, for me, it doesn't make a difference. You know, there's no homeless person who looks and says, ooh, I'm in CB1 now. Ooh, I'm in CB3. They don't see the lines. We just know that there's capacity built. We want the capacity to be built at another percentage. So you haven't even filled the other one yet.
No, you're right. Right, go ahead.
What are you gonna say something?
well, I was gonna say that, Washington Street is, after being open for 2 months, it's about 3/4 filled. So
It's filled.
it's filled?
It's
There
filled.
we go.
As of when?
It's filled.
As of today, it's filled? Okay.
So there's clearly a need. And so what's happening at East Broadway will be more opportunities for folks going through street homelessness. Same thing with Pearl Street.
Question, it's filled. Did you come up with the numbers on how many people in the facility are from our community and how many people are from outside of our community at the 105?
105, I think it's about half in our, in the community that we discussed below 14th Street.
So that's not priority. That's 50. And there's a reason why you need to open up a second one if max.
Yeah, I mean, on that point, I'll just go back to the last time we were here, we were shown, right? Chris, your diagram of the 311 numbers and like the green dots of community board one, where the 400 individuals are. But it seems like, right, again, that was just in community board one, we're saying there's a need, but again, those 400 people are not being placed in the community board one shelters.
Let me just say this about, so we can have clarity here. When an individual is homeless, they're transient. So the 400 people, today I'm here at 105 Washington, and I need to get my meal at St. Malachy's on 57th Street, and I'm tired, I beg down there. So the homeless people don't necessarily stay in CB1, so they can be classified as a CB1 homeless person. They're moving throughout the city to get services, but yet they may have a street location that the outreach team identifies them to be most connected to. So I want to give that clarity.
Great, because the people most connected to south of 14th Street were supposed to be the primary at every single solitary meeting. We've been shown how many people are homeless in our neighborhood. We were really excited to cheer for an opening to help the people who live in our community. Not that we don't care about others, but we were trying to focus on getting the people off the streets in our community and find a place. So it's disappointing to me to hear about 50% of the local shelter that's supposed to serve the local community is not serving the locals.
We can't force people inside. We're not an enforcement entity. We're engagement strategists that go out every day and try to make inroads with people who have been historically homeless, living unsheltered, whether it be in your CV or in
The
the subway.
promise was local.
There was no, let's be clear. There was no promise that everybody that was gonna go into 105 Washington was going to be local. There was a preference, and we based that off of the need from the demographics that we saw in Lower Manhattan.
So we
I just
don't have.
wanna
a
be
need.
really clear.
So does that mean that the need is
Elsewhere.
elsewhere and not here because you're filling it with 50% from elsewhere who
No,
won't
as
stay here?
As Julie was saying, there are folks that do identify their home location as Lower Manhattan. But there are also folks that are still experiencing street homelessness in Lower Manhattan that might be coming from a different area. They are choosing to bed down because they are physically in this area. So even though what we're identifying as about 50% is folks that actually telling us that they are from the community, there are other folks that are experiencing homelessness that are transient, as Julie said, that are in need of shelter, and we are providing.
I have a non sequitur. So are you guys aware of the gentleman who is in the downtown, #1 downtown World Trade Center? Before you get onto the platform, are you aware of that gentleman? He is a little dangerous. He's a little frightening.
Let me just say this to you, so I can be very clear. We do what we call binary lists of people, right? Our outreach teams go out, and if we don't know, say, we can't get the name through our engagement, we might say like the man you're identifying, right? That's in the World Trade Center, African American, Hispanic, or whatever, with X amount of clothes on. For clarity's sake, if you have someone that you're identifying as you're saying that may be dangerous, I want to make this very clear. Every night, the Department of Homeless Services, we employ nurses that go out and do, it's called the Scout Initiative, that engage people in the subway. So if you want to give me that information about this particular gentleman, we can have a nurse go and make an assessment. And that happens 7 days a week, 24 hours a day. We have nurses who visit people at street locations that are perceived to be a danger to themselves or others.
Okay, so other than 311, which, we would prefer to contact one of you, or if we can. So would you
It
give
would
us
be
that
mock.
information?
It would be MOC. Manhattan Outreach Consortium is the outreach team. Breaking Ground has a small portion of the Lower Manhattan contract, but MOC has the entire contract and has 4 other
So we
subcontract
just need to-
providers under them. So MOC runs CUCS, which is MOC runs 105, and they would be the outreach team
So what's
for the
another-
location.
We can get you the number.
Okay, because he has been there for a while, I've noticed him, he's,
What happens when, if Pat reported him to 311 or 911? Pat files a report for him. He's listed as a local. There are several, let them answer, because they're the ones that run the agencies. So let's hear what they have to say.
It goes into what we used to call the civil system, right? 311s get routed differently, right? If you just say homeless, if you don't say homeless, then it'll go to 911 and there may not be no follow-up. If you say homeless person, unsheltered in some way, acting out, then it gets routed to whatever outreach team has that area. What happens oftentimes is by the outreach time can have an hour to 2 hours to get there. So by the time the outreach team comes, that person has moved on. They're no longer there and the ticket gets closed.
And so how does that relate then? An hour to 2 hours when it's attached to a school? You've got kids outside, they're in the play yard, they file a 911 or a 311 because there's an interaction. I'm not gonna say what, but it's an interaction because right there, it's at the school. It's somebody who declined shelter, so it's not one of their clients. But he's hanging around the neighborhood because he's walked in, decided that's not his place, her place,
Doesn't the school
their
already
place.
have a low threshold for an individual who may be hanging around the school or building? Like anybody, if I'm a parent and I'm concerned about that, I would have a low threshold. The precinct is one police plaza is right up the block. Would not we call 911 to see about
But
getting?
now you're about to add
a
106
sector card,
people.
a sector card.
It's not one person, it's 106 people.
But let me just say, we're stigmatizing people, making it seem everybody that we would take in is inherently violent. And
I
Historically.
said incident, it could be anything, it could be
Right.
somebody sleeping on the street, it could be somebody violent, nonviolent. But the key here is what DHS and Breaking Ground have not taken into consideration is the assets that are needed that operate a school and to secure the kids, right? A privacy screen, okay, whatever. But is the school funded with security to be able to protect students? No, schools are underfunded. Is the school funded to be able to manage and close off the street? Nope, right? Does the school have cameras outside the building to protect their own kids? So the city as a institution is looking at it within the four walls of one. Breaking Ground is telling us they're gonna go out this way, that way, and whatever. They've actually never operated, no offense intended, attached to a school. I don't know any shelter in New York City that's actually attached to a school. If you can find one, then we would love to talk to that community, because Breaking Ground operates a shelter that is behind a school, that was a shelter for a long time, and it's behind a playground. It's not the front door, the side door, it's not the same kind of, it's a fenced-in playground, it's just not the same. So if you're gonna tell me, well, you know what, maybe we'll demap the street in front of the school, or maybe we're gonna put up adding guards, maybe, what are you doing to make this location other than programmatic? Because it shouldn't fall necessarily on Breaking Ground. It should fall on DHS, DSS, and the mayor's office to ensure that the assets the school needs for the school, because you chose to put this there. I don't think they would have built the school if it was necessarily there, or they would have built it differently. And with that, I'm gonna shut up because there are members of the public, my head hurts.
So last I saw, and I could be very outdated, when are you all planning to open? So I think I saw in January.
Yeah, I mean, in quarter 1, but probably towards the end of quarter 1, so most likely March.
Okay, and then building off of that, so you had to walk through with the school, what was their feedback? And then did y'all provide them with a plan, detailed plan of what to do?
Yep, so
Peggy's here from the PTA, she can speak to the school's perspective.
Okay. Do you want to start, Peggy?
Do you want me to speak?
Yeah.
Everything? Yes, I was not at the meeting.
Please introduce.
I'm Peggy, nice to meet you. So,
Yes.
I'm Peggy, I'm a parent at the Texas School. So I have a couple of issues that I want to.
Did they provide you details on what they are planning to do in support of the school? Do you know?
They did not, they did speak, all I know is that they did speak to the administration of the school.
Okay.
But I
I
also
I just want to be careful. I want to acknowledge that there's outstanding litigation right now
Yeah.
that you are a part of.
Yes.
So there's a limited amount of communication that can go on.
Okay.
Are you saying I cannot?
Well, there,
I'm
no,
not saying you can speak. I'm saying that.
well, there, I'm speaking to her, y'all don't need to speak to each other.
Gonna hide behind the lawyer. Say,
No,
Okay.
Go ahead, Peg.
with every kind of litigation, there's two sides to every story, and then whatever happens at the end. So it's a fair statement, I don't like it, but it's a very fair statement, and it's an honest one to provide transparency.
I didn't say it was
to the public.
unfair, I just.
Okay,
Go ahead.
okay, let's not have it.
Peggy.
Yeah, so let me just take a step back in terms of the question. Can you just repeat the question?
So what's the collective feedback that y'all have for them?
Yeah, so I wasn't a part of the conversation that they had with the school. I did hear that the same things that they spoke to us about today in terms of the protections that they're gonna provide is what they had the conversation with the school about. But from the parent community, we are, in opposition with the shelter going here because we have children. That's where I get emotional talking
All
about
right,
it.
so then, you know what, just hold on, because we know what the perspective is.
So so I won't answer his questions and I can talk after?
Yes.
I can still talk.
Okay.
Yes, so to answer your question, we were, it was with the school administration and PTA, but it was basically just all that was discussed was what they discussed here in terms of what they can do with the awning in the middle of the, courtyard, basically everything I spoke about here.
Windows only opening 4 inches.
And then when will y'all, or is the plan to follow up with the school with a detailed plan, and when will that be available?
So we're gonna have a meeting with the school. The school is gonna be hosting a Q&A with parents in December. And so we will be presenting there, and that's just the first of many ongoing conversations that we'll have with school leadership and parents.
Okay.
My question is, I'm sorry, but you're still proceeding as though you're going to get this contract, as if you're going to open.
Yes, I mean, we would need to be told by DHS or DSS to stop. They have not given us that direction, so at this point, yes, we are still planning.
I think part of the problem that was surfaced before, it seems as though the data is shifting. Because you're saying that we have all of these homeless people in our community, and that's why we have to have this specific location for our homeless population. But then we're also hearing, oh, but it's in other neighborhoods that we're pulling from, because, you know, the homeless people are transient. Where are these numbers coming from, and how are you collecting them, and why is it changing, and why is it sometimes people from above 14th Street, and then sometimes people down here that we're servicing? Why do we need more homeless shelters if they're not necessarily always here? That's my question.
So, I mean, what I can answer also too about outreach, because I've also been an outreach worker too, is that, you know, again, these folks, many of them have already been through shelter. They frequently refuse services for a while. We have to build our relationship and trust with them. And so it's about having the right resource at the right time when someone's willing to accept it. We could have every intention of only, having people within a certain geographic area, but they may not be willing to come inside that day. But we do have some other folks who are willing to come inside, but and this is again, our model is that we never give up. So we're just gonna always keep coming back. But it's always about being able to offer the right resource at the right time. People's motivation for change fluctuates and is very individualized. So the thing that motivates someone to come inside today, we can't necessarily predict.
I think the fear here is you're building in the worst location ever, and I'm a big supporter of homeless shelters, but we already know this. Is that you're telling us that you are building this homeless shelter or the safe haven in this location, and then it's going to be filled with people from outside the community, still leaving our community with the homelessness that are out there. And you're saying, oh, well, it might come at the moment of need, but then like we're not servicing this community, and this is what is being brought up frequently. Final thing I'll say around this, and this is something that's like stuck with me since the last time we talked, which is it's on you all to do your due diligence, and it sounds like you outsource it to them. And that's what made it turn into a real estate connection versus us actually serving the community. Like you all should have done the work to understand the location, the need, and not say, hey, Breaking Ground, is this the right place? Is this the right location? Because they are getting paid off of this. They are getting the contract. They're getting millions of dollars. We rely on you as city government officials to do this work. Please don't outsource it anymore. And I would hate to hear this in a future conversation about another shelter or safe haven.
So I'm gonna push back on the characterization of outsourcing it. Basically, what happens is a provider teams up with a property owner and they submit to our RFP.
I understand that.
Through that process, so they make an assessment to submit based off of the parameters of what they're seeing as a site that could potentially be useful as a safe haven. They submit that to the open RFP process. Then through that, we also do a review to see if this is an appropriate site for the use that they are proposing.
So the question that was asked to you last time, this is why it stuck with me, is how did y'all decide that this was a good location? And essentially what you said is they told us that this was a good location for XYZ reason. It wasn't because you as a government official said, oh yeah, I've been to that location. I understand the community. I understand where the homeless people are at. And I agree with them that this is the right location. And that's why I say it's outsourced, because you relied on them to do it.
I mean, again, I'm gonna push back on that characterization. I think.
You can push back, but I think it's essentially what it is.
Where are you? Like, you're just letting breaking ground at a developer. You make the decisions for, and you're the government. You're supposed to be
Yeah.
protecting us, these people. I mean, this is just laughable. It's a joke. I mean, we can sit here and talk and talk and talk and have another meeting for 3 hours, and everybody, you all know, okay, that this is not the appropriate site. It's like taking a square peg and trying to put it into a round hole, okay? You know it, you all know it. And we don't have to sit here and try to convince you of that, you know it. But this is the part where government steps in and says, no, we're not doing this because it's not good for the community. You're creating another problem. You think you're solving a problem by creating a shelter there, a safe haven there, fine. But then you're creating another problem for the children as well. And there are going to be problems. These, you keep on saying that, we guarantee you that we'll do all that we can to provide and yada, yada, yada. I'm sure you're wonderful providers, but ultimately you're not a prison. You can't control the people in your shelter. You can't control you can't tell them what to do. They will come out and they will do what they want to do ultimately. And you acknowledge that, And so why are we having this conversation again and again and again? We all know it's an inappropriate site. It should never have been allowed to sort of go through whatever vetting process. I mean, it doesn't seem like you guys do any vetting processes, but I mean, it should never have been allowed to do that. And I don't even know how it's come this far. You just need to say no.
I want to preface it with, again, we don't think that every homeless person that goes into a shelter or is out on the street is dangerous, murderous, a rapist, it's a criminal. But this is just not a great match. This really isn't a great match. And I agree with Elizabeth. I don't understand. It's true,
We get here.
yeah, how did we get to this? No.
Peggy wanted to add another point.
With the school that I just wanted to add in terms of, as a city agency, the DOE, which is another city agency, approved safety transfers for several families who left the school because of the shelter that is moving in. So if the DOE has deemed it approved safety transfer, and they themselves are seeing it as unsafe, and they're approving these families from moving the school system. So that's another.
How many families?
Right now there's 6.
So
Mine hasn't been approved yet.
And they went directly to the DOE. They didn't even go to the principal. They went directly.
So we said the DOE, that agency, which is a city agency, doesn't feel like it's the right location. But Mitch,
Well, my question was, I want to wait till this woman comes back. I wanted to ask her about the mock program, about a contact, because that's separate from this.
okay, we're gonna get the mock information.
Right, I thought that was a good program, separate from this.
Okay, so we'll get the mock information. Can I say something? Go ahead, Liz.
I just want to make one comment
Please
about.
introduce yourself.
I'm Liz Williams. I used to be on the community board. I've been downtown for 30 years. We lived actually next to, very close to a shelter for many, many years. My son grew up as a young child dealing with those issues on the street. But I do want to say something about what you do. My daughter and my kids have all gone through public school. My daughter is very good friends with a girl who has grown up in a homeless shelter in the Bronx. Her entire family has grown up in a homeless shelter. They have all gone through public school. They are all going to college. She went to Boston University on a scholarship. She got all her room and board paid. I mean, it's an incredible success story. And then we had the Water Street shelter by us of families. And the people there were, the mothers and the children were lovely. And it was such an incredibly powerfully positive experience to have this in our community. And I mean, I'm so glad my kids went to public schools so they could experience, have various friends from different walks of life. But the problem is that when you do something like what you're doing here now, like this lady says, a square peg in a round hole, you are now stereotyping homelessness like a really bad thing. And Fonda and her family are not a bad thing. And I think you just need to be careful
Because not only are you upsetting a community, you're also harming people who are in shelters right now, who are living life and trying to make themselves better. This is gonna get a lot of press. I work in the news business, I'm telling you. When a lawsuit drops, it's gonna get a lot of negative press. And, you know, I've talked to Fanta about, like, we should really, you know, have a story about, you know, but they're afraid. Why are they afraid? Because they're stereotyped. And I think you just need to be careful with that, because it's really been an incredibly successful, I mean, Fanta just, you know, anyway, my dog. They've been friends for a very long time and
Already.
I just want to make that.
You want to talk about the MOG?
Yes, I just.
We're gonna deal with that later. It's a separate issue. We're gonna
Okay.
deal with it later. I wanted to go down this,
Sorry.
thank you, Liz, I'm sorry. Go, anybody who wanted to speak?
I just think that.
Oh, Paul wanted to say something.
One last thing. The buck stops with you. The buck stops with you. You guys can just say no. That's what you should do. You should say no. But apparently, you know, this money that's coming in from this, you know, from this partnership or whatever, that's more important. You know, I don't know.
It is about money. Well,
As a Lower Manhattan resident who lives with my mother, Elizabeth Williams, who had trouble with the homeless people as we used to live near a shelter, I happen to be a Southbridge Child resident now, and I do not approve of this homeless shelter because if it comes and there'll be homeless people around, and they could cause services not only to the school, but also residents right near there, and including next door, and even everywhere Southbridge Towers, and even every building adjacent to it, including Southbridge Towers, my community, and I cannot tolerate this. So I suggest it could be closed down and moved someplace else, somewhere better for it, that couldn't cause much disturbances, that'd be suitable for any other neighborhood far away, that wouldn't be bothered to my residents and even the students.
Thank you, Paul.
That would be more suitable, that could be businesses are far away out of town, somewhere like Queens or anywhere that wouldn't disturb anybody wherever.
Thanks, Paul.
You're welcome.
All right, so.
I'm Anthony Hannigan. So first, you know, I also believe that, you know, safe havens are good for the community. I believe in the shelter system. You know, I have a very long history in it. It's really just the location. And, you know, I think saying that you're doing, you know, the square peg to a round hole is the perfect analogy. I think a round it to you and you are just forcing it through because you have to make it work because you said this is what sort of fell in your lap and you're forcing. I just want to touch on a couple of points. Said that.
And keep it to 2 minutes.
Try, yeah. You had said that, you know, it doesn't work as a family shelter because essentially there's no kitchens. I happen to be a professional engineer at an MEP firm. I can guarantee you that the electrical service to a hotel is adequate to provide 30 amp breakers for kitchens within the rooms. I'm sure. So you could do it, it's just no one wants to spend the money. You know, Breaking Ground has said a number of times, you know, we are not that provider. You know, like we're gonna do something differently, you know, even when we cite the problems at 105 Washington. You know, and that you're gonna do everything you can. The provider at 105 Washington, I believe, is CUCS, correct? And you believe that they are also a reputable provider?
Absolutely.
Okay, so they're having issues. I don't think it's because CUCS is not a reputable provider. I think they're a great provider. In fact, I believe CUCS is going to provide medical services at the 320 Pearl Street shelter location, correct?
Yeah.
Okay, so the problem is not the provider, and it's not how reputable, it's the demographic of the people that you're serving. And I don't believe that, you know, all 106 people are gonna cause a problem, right? But the reality is that your own model is that people are moving through your shelters in 6 months. That means that you're probably can expect 200 to 300 people every year, different people. Over the life of the contract, it's up to 1,500 people. It only, you know, we're parents, kids. It's not about one incident, it's too many.
Right.
So it's just statistically, you're talking about, you know, if 1% of your population causes a problem, you know, you're talking about 15 kids that get hurt. That's too many. You know, and when you talk about the problems at 105 Washington and that you're going to learn from it, you're going to continue, that means someone was harmed. That means a kid had to get scared, even if it's someone who is having a mental episode, right? They're just recently brought into your facility and they're leaving and they're confused and they're yelling at a child. It's not their fault. They're just trying to get home. But that kid is now going to be scared. and they're in a place where they should not have to ever be scared. School should be somewhere they look forward to going to. My daughter can't wait to go to school. And just like the idea of something like one incident like that will be traumatizing for them. So just imagine from like the kid's perspective, like it's not worth the risk. You know, like I understand this location fell into your lap, but for $90 million, you know, the 9-year extension of this contract, you can go and you can buy a building outright. Breaking Ground can own it in perpetuity. You can have it bigger. You know, it just doesn't make sense. So please do not force the take the wrong hole.
Thank you.
I just had a question, I don't know if I can ask, that kind of came up before, but in terms of 50% are local. If only 50% that are filling the current existing shelter are local residents, is there really a need to open up another one half a mile down the block? So
Yes,
so
there's absolutely.
are they also local residents, because why are they going, why are we 100%
So I
capacity?
think, we addressed this, but. there's
I understand
four-
the transient, I understand.
Right, so the numbers that we presented were the people that identified this Lower Manhattan as their home. That does not include transient people impacted by homelessness that are coming into this area. Remember, one of the reasons why this area is so impacted is because of the 2 large transit hubs.
All right, okay, so let me just so let me just get into my points and then.
2 minutes.
Okay, I'm just running out of this, right? Okay, so I just want to address the population changes, the proposed population changes. So the first one is older adults experiencing street homelessness over 55. That doesn't address any of our concerns. It's still a low barrier safety model. It is still, it is not discriminate people who have drug addiction issues that are going to be showing up to school. It is not discriminate of severe mental illness. That person that pushed, Simone Simon that pushed that woman into the subway was 61 years old. The guy that went and stabbed and murdered 3 people 2 days ago was 51 years old, just shy of 55 years old. It's not discriminate on age. So adding that age does not change the population that is going to be going to this safe haven shelter. The second, the medically vulnerable to comorbidities. I mean, mental illness is a comorbidity, substance abuse is a comorbidity, high blood pressure is a comorbidity. That's pretty much most of the population. Like right now, I have anxiety and high blood pressure. I have two comorbidities. That's everyone. It does not change the population. It is still a low barrier safe haven shelter. Street homelessness of advisors that requesting reasonable accommodation. Is that me?
Yeah.
Oh,
Finish up.
that's my question.
Finish up.
I would have done it. Really, I mean, that's all homeless people, but really, my biggest thing is, we have written hundreds of letters. We have spoke here so many times. There is, as you mentioned, a pending lawsuit. At what point doesn't somebody step back and say, hey, you know what? This is a really shitty location to be next to a school, considering how hard this fight is. Instead of saying, you know what? This doesn't make sense. Let's go somewhere else. You're going to lawyer up. You're going to keep fighting. You're going to try to make this work. I mean, how about look at the children? Look at the 146,000 children that are homeless. 1 in 8 children in the New York public school systems right now are homeless. And you don't want to solve that big problem because you don't want to try to figure out how to stick a stove in a room. But we're going to try to make this work where it doesn't work without paying any attention to the children that attend the school. Take a step back and look and say, hey, this is not working. And it's up to you at DSS to make that decision. Look at the 1 in 8 homeless children and find a solution for that we can actually accommodate in our school. Because it's your letters.
Go ahead, next.
I like to yield my time to Peggy. No, I'm Shelley Freeman, and I want to say that Elizabeth hit the nail on the head. This shelter at Peck, I'm not here about Peck Slip. I'm here for 105 Washington. I'm here for 105 Washington. The phone number.
Yeah, we're gonna get the phone number, just, yeah.
But this Peck Slip, Safe Haven, your position is indefensible. Peggy is right, Elizabeth is right. It's indefensible, and I don't know, I feel terrible for you guys. But my question question is about 105 Washington. Several of us in the last 2 days have seen this man on a mattress 50 feet from the front door of 105, 100 feet from the front door, 200 feet. We have called 311. We have called 911. Yesterday, it actually took 311 4 hours to close my complaint. I went and knocked on the door and I spoke to 2 security guys and I didn't want to leave. And so finally, somebody came out who I've met at one of these meetings. So she's pretty senior there. I don't know who she was. And she said, we can't do anything. We can't go out and help this guy come in. We gave him some food, is what she told me, which is great. And so the thing is, none of us are against these shelters. We're against lying to the public, which we know was done in 105 Washington, which is why Tammy realizes now. That's why Tammy doesn't trust you, because CUCS lied to us. We're against lying to the public. We're against homeless people literally lying on a mattress outside the shelter, right outside the door of the shelter, and nobody doing anything.
He is inside.
Pardon?
He is inside.
He is inside now today?
He has a name. We don't divulge names. But
I wanted to be taken care of.
You spoke to Paula Lackley, right? And oftentimes, pictures are painted, right? He was on the mattress. He kept moving. You had called. Outreach had gone to try to find him. He moved someplace out with the mattress. So they continued, right, they canvassed for him. And when the opportunity came, they reached out and they said, all of them reached out, the site reached out and said, can we bring him inside? He didn't have any history with us per se, but with the outreach team was like, listen, just identify him and give him a bed. So I believe early today, he was given a bed.
Great.
But it's.
That's great.
I want to say to you, if outreach stood on the corner when he was there with his mattress, we can't force anybody up off the
We know
mattress.
that.
We just have to keep going and engaging. I understand, this is very frustrating. I'm not gonna sit here and say, oh, it's the greatest location at 320 Pearl, but I'm with Aaron. We do try to make it work.
You know it's indefensible.
Right, we do try to make it
Hold up.
work.
All right, the 2 minutes, all right. But back and forth.
Can I just respond
Your
for a
2 minutes
moment?
are up. Your 2 minutes are up.
I understand that, but I got some new information. May I respond for a moment?
Quickly.
But, so I want you to understand the problem, which is the people in the shelter told me and many others in our group who have, about this one guy, there was nothing they could do. And it was 2 days. And my issue is 311 does nothing.
Was it within 10 minutes?
So the system's broken. That's what we're here to tell you. The system's broken. And that's why it's hard for us to trust that anything is gonna go right in a place that's already super problematic.
Okay.
I'm done now.
Yeah, okay, go ahead, next.
I'm gonna piggyback off of that, but so that's really good background. I'm concerned then too, so I am also part of, I live in the street from 105. What we're seeing there is that whether it's clients who have been placed there and then decide to leave or are kicked out, which you're saying, so you're
There's no
like
such
that.
thing as being kicked out. There's no such thing as being kicked out of.
Leave removed or asked to leave the premises, whatever the technicality is.
They decide to leave on their
Their
own.
own.
That's what they're doing.
Well, whatever the case is, in any of these scenarios where that happens, we're seeing how then it turns into loitering or other issues. And then, as we've already talked about, dozens then of 311 calls, whatever. So then the way that translates then for next to a school, it's really concerning knowing that that's what's, I know that's on the agenda. So with that being next to a school, I'm seeing in front of my lobby where my door gonna have to shoot people away. Really exciting. I'm seeing the effect of that. I'm feeling the effects of how now it's becoming more full. I'm feeling it and I'm seeing it and I'm living it every day. And it's super frustrating. So what happens then when that same scenario will be repeated and duplicated right next to children's? I mean, we can't say that it's gonna be this big thing. It's like we're seeing what the after effects is on the community. We've been told that they can't do anything outside of their 1 block radius. So then it's just funny, like the mattress is like across the street from the 1 block. on both sides and just things like that. So, I mean, how is this next one gonna be different? I mean, in front of such a much more vulnerable population.
So let's let Chris answer that, because in the ultimate end answer, it is DHS's responsibility.
Well, like I said previously, when we were evaluating this site, we decided to go, because of Breaking Ground's experience in operating sites with this type of population, we felt that they were best suited to be able to handle a facility in what is a challenging location.
No, wait, go back and forth, go back and forth. So Chris, they're asking you about outside, not inside. Inside, we get it.
And so I think Aaron also said that Breaking Ground was going to have a presence outside. As we heard from Julie, the mock team is also going to have a presence outside. We were very much aware of the incident with the client that was right outside of CUCS. And we had our team out there trying to engage with him to get him to come inside. It takes time. It takes time.
I understand, and the issue is going to keep happening, not only at this location and the others. When we're hearing about like solutions that will be figured out, your own words is that it may take a year. So what does it take? What will it take for it not to be, for that actually to be prioritized? Not only there, but also at Arlo, at the 1 and 5 and everywhere else.
All right, let's keep it to the 320 at the moment.
No, I did,
Okay, thank you. So you just said that, CUCS is also a reputable provider.
Anthony?
No, I said it.
Oh, all right.
And then, so they're operating at 105. They're having problems that cannot happen at 320 Pearl. Because if it happens at 320 Pearl, you're talking about children. One incident is too many.
All right,
So
we said it.
yeah, but you can't have
You
one.
said it, you said it a couple of times.
Heard you.
It's his,
And agree.
I'm sorry, I forgot your name. And you can bring your son this time.
Your clothes, yes. And in fact, I was gonna say, my name is Timothy Green, and I'm a resident of South British Towers. And I have a son who attends excellent school. And in fact, he's watching the meeting today. And there isn't a day he doesn't come home and ask, what's happening in the shelter? And it is adversely impacting his studies at school in fourth grade. Now, granted, I have a year left. People try to approach the Department of Education and transfer because of the facility going on. We can't stress enough that this is a horrible location. It's not the fact that the state haven goes up, it's already having an adverse effect on the kids. It's already having an adverse effect on the kids. You can't tell me that you can keep coach the kids now, because it's not only the safe haven that's going up, it's what they think about and what they do on a day-to-day basis. Whether they're gonna, and the parents, whether their kids are gonna run into some kind of situation. It is an adverse effect already, every day.
Is there a question?
No question, it's conversation.
Thank you. Next? Oh, it's Max. You wanna say something, Max?
I can.
Yes.
Please do.
Yeah, I mean, again, there's not much more that hasn't been said already, but again, I would just reiterate, right? Chris, to your point, these things take time. Again, this is not a critique. Breaking Ground, I know, is a great provider. But when you're right next to a school, right, this just creates that time, as Anthony was saying, that time doesn't exist because the immediate impact is that, right, little kids are the, can be impacted. All it takes is one person, right, to refuse service, set up you have the barrier, one person who decides there's a little alcove on the second next slip, they're gonna sit down there and, again, reasonably, right, they wanna sit, they wanna wait, it's a little sheltered spot, right? And that's not Breaking Ground's responsibility. You might have teams out there, you might know they're gonna be there. But again, all it takes is one person to say, I'm just gonna sit down in front of the Peckford school, and now what happens? How do the kids get in that school? Right? You may not know, and then what if it's not one of those times where someone's out there, or where the camera maybe can't catch it? What happens in that situation? I think that's, again, is one of the many questions and one of the issues that we're seeing here is that, right, well, you're not saying it's an experiment, but the reality is, you said we don't, right, it's gonna take time to adjust. That means you are experimenting with it. And so, right, this is not the place for experimentation. Yeah. And that's our position, and, we'll continue to advocate that, but yeah, again, I think what everyone's saying is what we're all feeling is that this is not the right location.
Thanks, Max.
I
We have
think we
three
have
people
to-
online.
sorry.
Three people online. Yeah.
Do you want to do online?
Yeah, no, go, you can go first. Yes.
Frank Conti, first meeting, 333 Pearl Street. Just real quick, just because I'm new to this, pretty much, what would be the process to getting this stopped, per se? How far the way?
That's what this is, old videos.
Is this all we have in terms of our options? Is there petitions to sign, or is it just really in the
We have a
government?
lawsuit.
Yeah, no,
We don't really have any.
How does it stop?
Keep writing the mayor's office, join their lawsuit if you're in the.
Folks are taking.
How does it stop?
folks are taking legal actions. You guys have made your voices heard. Trust me, everybody up the chain is very aware of this thing. And at this point, as I've said multiple times, the decision has been made that because of the urgency of dealing with the street homelessness issue here in Lower Manhattan, that this, because we have a great provider, there is enough evidence to suggest that this site will be successful.
All right, well, let's let, everybody, we have three people online.
Ryan Fisher, you can speak.
Yeah, can you hear me?
Chris, you're with Chris, right?
Can you hear?
Go ahead, Ryan.
Yeah, so I'd like a little more clarification on the mattress individual, because we were told several times that this person had no association with the shelter. But now they do.
Well, he's in the shelter now, so this really isn't a conversation about that, but he has been engaged and he is now at 105.
Yeah, and that's
Yeah.
why we're talking about 320.
Yeah, we're talking about 320, so do you have a question about 320?
Pearl Street. So.
No, I really don't, but it's more of a list of issues with the shelter at 105 because this is sort of the playbook here is to investigate who is or isn't, and it's very hard to know who is or isn't associated with the shelter. But I'm just here to represent that, Carlisle and Washington Street, a half block away from 105, is now occupied by like 5 or more individuals on most nights, smoking, using drugs, that kind of stuff. So like the playbook is to hide, just hide behind who is or isn't in the shelter. And as we've represented here, like the real issue is like, the shelter operator only really looks for what's going on inside the walls, but the community is pretty frustrated about the results outside of the walls. So I have a couple other issues here. Only 6 members of the actual community on the community advisory board. That's pretty concerning. The 24/7, 365 shelter line is not being answered consistently.
This is not.
911 is not responding to calls. Like there's an instance where this individual was in the street.
Ryan, we're gonna have to mute you. It has to be about 320 Pearl Street. There's a CAB meeting coming up, 105. Speak to your representative from your community. They can bring the questions and your issues to the meeting.
I do think of these issues to translate that.
I got it. Next.
Catherine Rafa. Go ahead.
Keep it 320.
Hi, this is Catherine Rafa. Can you hear me okay?
Yes, we can.
Great. I'm Catherine Rafa. I'm sorry I couldn't make it in person today. I live on Pearl Street. Again, this location is a non-starter. You are not listening to the community, to both DHS and Breaking Ground. Why did you cancel your attendance at last month's Quality of Life Committee? You are not operating in good faith. Why should we take your word? Where is Slate? Why should I care that it would cost them more money to renovate the building to become a family shelter? Maybe they.
Let me just interrupt you for a second. They didn't cancel. There was a mix-up.
Okay. Well, I still want to know, where is Slate? Now, DHS, you proposed a shelter for people with comorbidities, including mental health and drug addiction. How is that different than a safe haven? Breaking Ground, you operate permanent low-income housing. We would love permanent low-income housing in the neighborhood. We talk about the children being vulnerable population. I totally agree. Breaking Ground, you said you will tell your clients to walk across the street. Southbridge Towers is a naturally occurring retirement community that is low and middle income. Are they not a vulnerable population too? We're not a guinea pig for you to try and put more shelters next to more schools. We're going to keep fighting you. Thank you. That's all I have.
Thanks, Peg.
Lisa Vega. Go ahead.
And I'm glad that Catherine, yes, can you hear me?
Yes, thank you.
Hi. I just wanted to mention was something that Catherine touched on is that I was really baffled by the framing that Slate, the building owner, is the party that's really set on this being a safe haven. You know, buying a commercial property in New York City doesn't, shouldn't come with a guarantee of a lucrative city contract. So I'm not sure how that's relevant. And I don't understand how Slate's preference takes precedence over an entire public school community. And again, I know that we talk a lot about like the dangers of the kids, and I definitely agree with that and concerned. But in terms of just also how it affects the school community, as we all know, schools are funded based on enrollment, and if enrollment goes down, we lose funding, we lose valued teachers. It's a really important issue. Even if it's somehow run 100% safely, people will still leave, and I don't understand how what Slate wants takes precedence over an entire public school community. And again, the elephant in the room is that, per the New York Times reporting just like 3 years ago, is that Slate has longtime ties with Mayor Adams, who has been indicted for corruption. And I don't understand how at a time when the confidence in our city government is at an all-time low, now more than ever, a city agency like DHS should be going out of its way to avoid even the appearance of corruption, in order to to have people have safe, have confidence in our city government. So even if you guys are saying this is somehow amazingly above board, you did all of those and somehow in 4 weeks from May when Breaking Ground proposes and June when you sent the note, which does not sound credible because you didn't even do like a walkthrough at that time before you sent the notice. Even if somehow it is somehow all above board, it looks and smells really bad. And the city should not be taking any action that looks and smells this bad, especially now. And I would like you to tell me.
That's your 2 minutes. Thank you.
Do you want to address the Slate question of how they are able to determine that it's a safe haven and that's what it has to be?
I think we did. Slate came to Breaking Ground with, and they teamed up. They saw this site as this was the best option for this site. They submitted to the.
We've talked about it at every meeting. So one more person.
Rick, Letizia, can speak.
Can you hear me?
Yep, we can hear you.
As I say in every meeting that I have to speak in, I am so disgusted by the city that I waste my free time having to keep my children away from this kind of shelter. It's becoming really frustrating to the point where it's probably just going to be easier to move than to deal with this. And it seems like that's what you guys are looking for, is to discourage our community, our children, and our school from continuing. I have a very specific question. I won't go through the same old thing that I say every time about keeping kids safe, needles, and all that stuff, which you still cannot provide an answer for. But I'd like to Breaking Ground to speak to the stabbing, I believe in Brooklyn in July, and how they're going to prevent that from happening to one of our kids.
In July, there was a stabbing at a Times Square location, a Breaking Ground property in Times Square.
So they
Oh, Times Square, yeah. Yeah, I thought it was Brooklyn. But something did happen in Brooklyn this summer as well. But let's go to the Times Square.
So the Times Square building is permanent housing. Those are tenants who may have histories of formerly homeless. There was an issue where, yes, a tenant did kill another tenant, or I believe, not sure. But those are folks who are that's permanent housing. So it's not the same as shelter. These are individuals. Also, those are apartments where people have a lot more freedom because they have tenancy rights. At safe havens, every person is wanted when they enter the facility. Every bag is searched. We also have the ability to open up any client's dorm room, locker, storage area, room, bed, and do searches as needed, as frequently as we want. So there's a lot more safety sort of parameters in place at a safe haven than with any apartment housing, because just as all of you in your apartment building do not get bonded and searched when you bring items into your home, the same holds true for tenancy rights in permanent supportive housing.
Okay, that answer, anybody else online?
Nope.
Okay. It's 8:05. We've all had an opportunity to speak. I know we're not happy with the answers, but we have had an opportunity to speak, so now we're gonna leave it up. You guys are gonna continue your lawsuit, and we're gonna leave it up to both of you to think about what was the housing you were saying, supportive housing?
we would like DHS officially, and if we have to pass a resolution on this, we would like DHS to officially talk to, HPD, thank you, sorry, brain's a little murky tonight. To talk to HPD and to have a meeting with Slate, because that is what the community would like to support and celebrate, is a place that when you have your other safe haven open and you already have this one full, that there might be a place that people who are on their way to success can actually find a place to stay and have supportive housing. That would be great. We'd like to understand why that's not possible. We'd also like to know that there are other models other than safe haven models. That why aren't any of those being considered? You just keep talking safe haven, and even in the letter, it's divided into safe haven for women, safe haven for this, for families, safe haven. DHS does other types of shelters for people who are further along in their journey that maybe are somewhere between safe haven and supportive housing, correct?
But we also wanted you to think about, I know that the floor plan is already, but they haven't built anything yet, right? There's no interior construction. So again, with the stove or hot plate or, convection oven, they can have a facility to do some cooking, so we don't understand why the floor plan can't be changed to have, to accommodate families.
And especially considering we have homeless migrant families in the school. It's not like it's an unsupportive community. Community runs clothing drives and book drives and supply drives and everything for the families. Because it is a supportive community. Because families fit in public schools. So so we'd like DHS to come back to us with it. And for breaking ground, please don't be offended when we say we don't want you here for a safe haven. It's not about you individually, it's about the type of shelter that it is. It's an inappropriate citing of a location, period.
So thank you for everyone's time,
Could I
and
just
let's,
add one thing? Can I say one last thing?
very fast. And it has to be something that hasn't been said already.
Yes, not that it hasn't been said. Do I ever repeat anything that you said?
Yes.
I would disagree. Anyway, there was recently a contract that was canceled because of a relationship to, I think it was from the Department of Aging. Was because there was a relationship between one of the donors to the mayor. And the members of the city council protested, including our city council member. Is there any chance that this whole proposal could be reevaluated on that basis, based on, you know, what people have said here, that an appearance of required?
That's the point of.
Right, exactly. The RFP, the review, that's what all of that took into account.
And like the mayor's office of contracts.
The answer is no.
That's their job to.
No, the answer is it's already happened.
All right, so let's talk, because did you get the information for the mock? Okay, so you'll send it to us and then we'll distribute it. And also, don't forget about the gentleman that is, Tracy's gone, the gentleman that is in the downtown one station in the World Trade Center. He's generally in various degrees of unemployment, and he seems a little, I mean, I'm pretty tough, but he seems a little scary.
Yeah, so send us whatever information.
That's all I got. He's an African American man.
And we
He's
would,
young.
and we would also expect, that if your contract is signed, that we don't find out from something, you know, posted somewhere that somebody from the public has to know, for partnership for the community being more transparent would be great.
Unless it slid in a sentence and I asked, wait, so you're gonna open up the shelter within 24, 48 hours and you left?
And there's.
So we would like to know when the contract is signed, because the contracts and the final sign-offs for 105 happened within 24 hours of doors opening. Now, for that, we had been in dialogue since 2018 about that building, so it's a different conversation. We were notified in June about this location. So we want
It's not 5 years.
it's not 5 years of back and forth. This is barely even 5 months. And we want greater transparency, because what the frustrating thing to have the community find out in June was the fact that Slate and Breaking Ground knew 8 months easily before. And the community didn't.
Don't you want them to not sign the contract versus tell us?
Well,
what
that's a whole
contract
other
to sign?
Yeah.
We've already made that clear, Sean, that's what we would prefer, but in case for some odd reason it does go through, we'd appreciate notification.
And then maybe next month, well, let's talk offline. Yeah, let's see where you get with everything.
Yeah, see where that agenda is.
Yeah.
Well, it's gonna be about my questions since we went.
What was that?
When I mentioned the, question, my comment about how, well, last time I had asked, 24, 48 hours, and we all know what happened there. He said, what? And he just looked over. So I'm just wondering if you can help clarify what the confusion was.
I didn't hear your question,
Oh, you can just.
so you can repeat it.
What she was saying is that it'd be great to have more public announcement.
And I agreed to that.
So I had said yes, and hopefully not just slid in the middle of a sentence to where then myself or somebody else has to say, wait, did I catch that? You're saying that we're opening in 24, 48 business, like in one business day? And then you were like, yeah, and then the whole room erupted. That's not really an adequate public announcement. So my ask is that.
So we will,
Same ask.
yeah, it's the exact same ask. So what we will do, and we have agreed to, we will comply with the law, but we will go further than that to
We
make,
appreciate
And I'm
it.
repeating it. So, and we will do what we will make sure that we hit every milestone with you guys to make sure you guys are as well informed as possible. The contract process is what it is. I mean, we found out, as soon as we found out, we told you. So that's what I can.
It's not personal. Thank you. Thank you.
Okay.
Good night, everybody. Thank you, everyone.